LiveIntent, one of the co-founders and chief business officer. And just for those who are unfamiliar with LiveIntent, we took the best of advertising technology and married it up to the best marketing channel ever created from our perspective, which is email. We created the fourth largest logged in media channel outside of Facebook, Amazon, and Google. And we make it possible for brands to reach over 200 million consumers in North America every month as they consume email. Email newsletters, alerts, announcements, transactional emails. And these emails are actually sent and delivered by traditional publishers like the New York Times and Washington Post, but also non-traditional publishers like Walmart and Kraft and General Mills and Fanatics. So if you want to reach people as they're consuming email newsletters, LiveIntent is definitely the place to do it in a real-time bidding format. So without further ado, people came here to talk to hear what you have to say. So let's dive in. Just love to kind of hear a little bit more from you, Mehdi, on what brought you to Moda, and tell us a little bit about your journey that brought you here, and then what you do at the current company.
Sure, a lot to cover there. So prior to Moda, I was at innovation design branding firm called Ziba for about a decade, where we worked across many Fortune companies around innovation, across all the different types of innovation, whether it was business model, product design, service design, experience design, retail, and so forth. And Moda Health was a client that we helped rebrand the organization. So I kind of joined them to help build a brand, since we renamed the organization and rebranded them. So that's how I came to Moda Health, and I've been with the organization for about 6.5 years. Moda Health is a regional healthcare organization, a very entrepreneurial organization, primarily in the health insurance business. That's medical, dental, as well as pharmacy, across all lines of business: commercial, Medicare, individual, Medicaid. And we have a portfolio of businesses, about 10 different businesses, all across the value chain of the healthcare. So that gives you a little bit of context about me. I'm happy to go more in depth, Jason.
Oh no, and you know, as the CMO, and you know, I think most people understand what CMOs do, but within your company, what is your primary focus as the CMO?
Well, it covers all aspects of marketing. It covers brand building, it covers product marketing, it covers digital experiences. So it's the entire spectrum. It covers, we have a great sponsorship with the title sponsors of the Portland Trailblazers. So that's an important aspect of our marketing. So it really, I mean, communication with our members, providers. So it's the full spectrum.
That's great. Well, gives you plenty to work on and never be bored, I'm sure.
Yeah, bored. You know, it's always, marketing is always so exciting. I mean, you're always trying to stay relevant from what's happening in the market, the cultural aspects that are continuously evolving. I talked about the different generations that we're trying to market to today, especially in healthcare. You know, we have potentially 5 generations today in the workforce, and every one of them is uniquely different. So, and then, you know, the media and the channels are always constantly expanding. So you're never bored being in a marketing function. That's for sure. Yeah.
You know, hard to talk about healthcare and not talk about the pandemic. Obviously, last year was you know, a terrible year in many respects. You know, but you're in healthcare, so I'd love to hear a little bit from your perspective how the pandemic impacted your business, your customers, you know, acquisition and retention, you know, from that perspective, and then maybe a perspective on the impact it had on your on people that you work with. Like, were you able to work from home, and how it impacted your business that way? But starting with the customer and
certainly.
that core.
Well, I think one of the things that there was a number of things that obviously we noticed. One was people were less reluctant to change. So acquisition became much more difficult, right? There's always risks when you're trying to change your healthcare provider. And in the midst of a pandemic, you're not going to be doing that. So acquisition was certainly much more challenging, which meant there was a higher level of retention, right? So, and obviously utilization of your benefits was also significantly less. But we've seen that pick up. But also we saw the increase in utilization of new ways of, in terms of telemedicine, for example. That became, a new way that people engage with their providers. Prior to the COVID, it was starting to increase a little bit, but it still was significantly less. I mean, telemedicine, telehealth has been around for a long time, but the utilization of them was very low. But with the COVID, we saw that significantly increased. In some cases, it went from single digits to the mid-30s in terms of adoption, and now it's back probably to the 18 and 19%. We also saw that mostly with primary care, but also in other specialties like mental health, for example. So it created new habits, and it was good for the consumer because they were able to access providers in more ways than before, in terms of in after hours and over weekends. And access often can be difficult, and yet they were able to make appointments for the same day. So these were all great benefits for the consumers. And I think in many ways also providers also benefit from them, because now they could interact with their patients, not just from their office, but from their home at their convenient time. So I think it brought a lot more a balance of work-life balance for the physicians also. So those are some of the changes that we've seen. Obviously, there's other changes that are happening with devices entering the market, and I think we'll continue to do so. In terms of our marketing function working from home, I don't think we missed a beat. Obviously, it was much more difficult and in some cases not possible to create, for example, new advertising campaigns and do advertising shoots and so forth. But for the rest of it, it was, in many ways, in some ways actually became more productive, believe it or not, because you didn't have the interruptions of dailies and just being able to connect one-on-one much more frequently and stay in touch. So we found that to be very effective, actually. The only area of challenge, I think, was often around when you're doing concepting and brainstorming. That was a lot more challenging, and we were able to still adopt some tools that enabled us to get better at it, but kind of nothing replaces that, being in person, building on each other's thoughts and ideas, seeing a lot of creatives on the walls, all that kind of stuff was probably the area that we kind of missed the most.
And I feel like a lot of us had bias against maybe working from home. I know that I did, so I can only maybe speak for myself, but a lot of other managers and a lot of other people around me, in any business, I imagine that there's probably doctors and hospitals that were also reluctant to fully embrace telemedicine, and they probably had to go through a lot of advancement, a lot of evolution to be able to support all those people that wanted to do telemedicine. At first I struggled. I'm a caregiver for my mom who lives in Minneapolis and I live in Brooklyn. And just trying to get her doctor to say, listen, she's in pain. It's hard for her to get to the doctor. Can we just talk about this? And their preset seemed to always be, no, we really want to see her. And so now it's much easier. Now they're like, no, we can totally do this appointment. So that's always my first question. Like, right, we have to accomplish this. Can we do this virtually? So do you feel like, the healthcare providers and maybe even you guys had to evolve very quickly? And what did you need to do to respond to the new paradigm of doing more telemedicine?
Well, I think technology helps a lot, right? So, I mean, if you think about it, I had the same reservations about working from home, because in the past, when you worked from home, you were not really connected. We did not have the Zooms and the Teams and all of that. So I think we have to remember that's the enabler that has enabled us to cross the chasm and create these experiences that we all feel like are compelling and can work. So to me, that's been the big change. And when we were able to connect as many people as possible virtually, that was very different to previously being on a phone, not being able to see expressions, not being able to share documents. So I think that was a big factor. And I think the same with in terms of providers. In providers in the past, we used to have a service called eDoc, where you could send an email to your doctor and send, for example, if you had a photo of your rash, you could send it. But that's not the same thing as being in a two-way synchronous way of talking to your doctor and having that continuous dialogue versus me sending something, waiting for to get it back. So I think it's the technology that's kind of enabled us to really, cross the chasm and adopt these new experiences.
And speaking of the technology issue that it seems to be rampant in healthcare is having one view of the customer, or even the customer having one view of themselves. Some people use MyChart, other people use other systems, and those systems actually don't really communicate very well. So that becomes, the advocates, like I have to marry up those different systems to make sure the med lists are exactly the same and things like that. Is there more focus out there trying to connect the dots so it makes it easier for the consumer, especially someone who's older, maybe suffering from Alzheimer's or something? Like right now, it's way too complicated.
Yeah, definitely. There's more mandates from the government in terms of interoperability that's happening. I think you're going to see a lot more of that going on moving forward, because obviously that's a big gap. I mean, if you're moving from one state to another, right, and you want to make sure your data is available to the physician. So to your point, seeing that real 360 view of the customer, I think is critical to providing the right level of treatment and diagnosis. So I think we're going to get there in the next few years with some of the things that are going on in terms of mandates. Great.
So outside, so last year we know the challenges that we all had, last year. Now we got, this year going on. So over the next 12 months, what do you see as some of the bigger challenges that you're facing from a marketing team perspective, or from just overall marketing perspective?
I mean, I think the marketing perspective, we're kind of back to the pre-COVID soon. And it's always about building relationships with customers. It's about being authentic. It's about being relevant to them. And it's getting more and more complex to be able to do that because of, the expansion of so much content in our world, right? I talk about the content is a real issue because it's not just the volume, but our ability to retain is also being diminished. So even if you have a great ad, but in 2 seconds later, you saw another 50 ads. So the ability to recall that is becoming more of a challenge. And I think all this leads to more in terms of how do you build long-term relationships, and not just through advertising, but through the experience that they have with your brands in every interaction. I'm still a big believer in the word of mouth. And I think that only comes with people truly having great experiences, having personal experiences. And I think the one I talk about a lot, I think I shared that with you, Jason, was about context. I think that's the most important factor, is context. A lot of times brands are interacting with customers not when they want to be interacted with, when that's your service is their top of mind. And that certainly happens a lot in healthcare too, especially because in healthcare, purchasing happens in the individual and Medicare over a few weeks, right?
So 6 weeks?
6 weeks, open enrollment, right? So, but also in terms of experiences with providers and hospitals, it's those moments of truth. And those moments of truth are in the context of, did I just have an accident? Did I have an injury, or did I, was I diagnosed with a chronic conditions? So context is, I believe, is critical. It's only when you have the right context is then when you can actually personalize them.
Right.
So to me, contextualization is a critical success factor. And it's hard because you have so many different people, so many different situations. In many industries like healthcare, the customer journey is not linear, where you have bought the product, I go through it, purchase it, use it, right? It's episodic. For example, in healthcare, you could be healthy today and never go to a doctor, and all of a sudden you're using it because you got this condition and you're going to be in the hospital and then care and so forth. So it's much more complex within the context of healthcare.
Well, then what it makes it even more complex is, one, you have to figure out how to use context in, when advertising. So when you're trying to acquire net new customers, and that's where that 6-week open enrollment period is so critical. And then using context when they are a customer, and then making them, like aiding them and understanding their needs and making sure they're aware of what needs to happen next, and then maybe coaching them through that next step and leveraging context to make sure they have a good experience throughout that journey. So on the front end, when it comes to advertising, net new customers that you're going after, how are you able to leverage context and then marry the context with the messaging and with the overlay of HIPAA regulations? Because you can use some information, you can't use other information. Right. So talk to us about that complexity.
Well, you just, again, it's not easy, and you have to be super clear about your segmentation, right? And also you have to be very clear about using your data. Data science becomes really important factor, because knowing who's already purchased your product can give you a good indication who's likely to purchase your product, right? So, and obviously there's third-party information too. It's really trying to put the puzzle together and really understanding who is your real audience. It's not everyone, obviously, right? And being super clear as to what's the most effective way to reach them and impact them. That's the same for retention too. In the context of retention, you always have a lot more information about them because you have a history of their interactions with you. You have a history of their medical situation. So you can really develop a much more comprehensive insights using those data and intelligence to really trying to make connections with them. And that's what we're investing a lot of time and money trying to do that. And that doesn't mean you're always going to be spot on at time, but at least you're in the the boundaries of relevancy of time or moments that you can really make that interactions in a way that's meaningful and relevant to them.
Right. I imagine that some of the easier targeting that you're doing around these groups that you're going after would be simple age, obviously. When you're doing that, are you going after both the people that want to get the coverage, but also possibly caregivers? So instead of just looking at people 65 plus that can, come into a program, are you also going after the caregivers? Like, what is that?
Yeah, definitely. I think when it comes to Medicare, again, in the different lines of healthcare, you have individual market, you have Medicare, you have Medicaid, and each of those you have to treat very differently. So in the context of Medicare, definitely you have to understand the caregiver are often the decision makers, right? So being able to reach them is critical. So you basically have to know your customer, understand the purchasing decisions, the priorities in what they're seeking, and obviously trying to address those, but also understanding who is the customer that your brand is trying to connect with, right? It's not every customer. Who's that strategic customer that you're trying to reach because you're trying to deliver a promise to them, right? And you believe those people would value the promise that you're trying to offer them. So being really clear about who that is.
Right. And you had mentioned that, sometimes knowing your current customer will help you sometimes identify net new customers, the right cohorts. We may have talked a little bit about this during our prep, but you are familiar with LookAlike Audiences a little bit. So that's where you may upload a set of customers that look a lot like your best customers. Right. You're looking for people that are going to act alike or look a lot like them. But yet you're balancing, the ability to do those things with HIPAA regulations and things like that. So are you currently using LookAlike Audiences with the likes of Facebook or anybody else where you're uploading a segment and say, hey, go find me more people that look like this?
We're at the beginning of it, to be honest with you. We have to be kind of mindful, again, like you said, the HIPAA regulations. So we're sort of starting to scratch the surface. That's probably the best way to put it. Yeah, I mean, we're also doing a lot of studies around, purchase propensity, right? Who's more likely to purchase you? And so leveraging our own data and other sets, and then hopefully being able to marry that with the likes that you just mentioned, so we can find more of those people.
Great. For those in the audience who are curious about lookalikes and how that works with HIPAA, I've been prepping for a roundtable around healthcare and stuff. And what I was told was that you can still do lookalike audiences. You're uploading email hashes of those customers to someone like a Facebook or a LiveIntent. And as long as that publisher is HIPAA, compliant, then you can go ahead and leverage some first-party data to do things like lookalikes, or maybe eventually having an audience that you might be able to suppress. So it's like, hey, I want to find net new, but I don't want any of my current customers to see these advertisements. I don't want to waste a single dollar trying to convert someone that's already converted. So it seems like healthcare is definitely evolving and finding new ways, or existing ways of leveraging first-party data without having any regulatory issues. So
yeah, it's a process, and you got to be obviously careful because of the regulations, and make sure you're within the guidelines. And some areas is very stringent.
Yeah. When it comes to some of the segmentation things that we're talking about, a lot of people are very freaked out about the cookieless world that is possibly coming, the cookie apocalypse, the deprecation of third-party cookie, and IDFA by Apple. There's lots of new things that have been, that are coming out that make targeting and optimization and attribution a lot more difficult. Love to kind of hear from your perspective, how do these headwinds impact your business, and maybe what are some of the things that you're doing around, targeting, optimization, attribution in a cookieless world, what you might be doing to prepare for that, or what you might be doing in the future to prepare for that?
Yeah, I mean, we're obviously monitoring it and looking at how it will be impacted, but in terms of overall, again, the different channels of how people purchase healthcare is it's somewhat unique, because in the context of individual market, you can go to the government site, right? And that's where a lot of people go. So some come to your site, and then you have the agents and so forth. So in terms of its overall impact, it's probably a lot less than some of the other businesses. That's for sure. But we are constantly looking at ways to optimize it, retarget, and do those things. And I think we've seen some good results, but again, it varies depending on the segment of the line of business that you're in, and because of the reasons I explained to you. But again, we are also looking at monitoring what's going on with the cookieless world and how that impacts, and seeing what that means for our business. So I think this year will be very interesting in terms of as we go through it, and the insights that will come from that.
Some people are out there, rethinking how you buy media. The cookie allowed you to get at the individual level, or somewhat, probabilistic, not deterministic. But sometimes probabilistic can be good enough. As that stuff becomes more complicated, it seems like some buyers are going more into buying cohorts of customers, like groups, like a PMP. You mentioned context is really super important to you. So content and context is really super important. So are you out there buying private marketplaces, PMPs, and saying, yeah, we're interested in people that are visiting this sort of content. So if we can either find them when they're in that content, or after they've maybe left that content and they're somewhere else, like are you trying to buy potentially audiences or cohorts in a different way that maybe isn't dependent as much on cookies?
Not yet. Not yet. That's, again, some of the areas that we're starting to explore as to what it means for us. Again, in healthcare, because of so many factors, regulations, state regulations, federal, it's kind of behind the other industries in many ways when it comes to a lot of the technologies. So, and you also have to kind of, you don't want to be the disruptor necessarily. So you kind of have to sort of see how it's proven before you get into it. So we kind of try to be an early adopter, but not necessarily trying to be the first one, trying to address a lot of these things.
Not a lot of massive innovation starting with, within healthcare. Usually healthcare is a reluctant follower, but that's not your problem. That's the whole industry.
It's the industry. I mean, we're talking about people's health. We're talking about, and it's an expensive purchase, obviously as well, and it's very highly regulated. So all those things probably are the reasons why, for the kind of being behind the innovation in terms of marketing compared to some of the other industries.
Yeah. From a media mix perspective, talk to me a little bit about the mix of media, whether it's, TV, outdoor, radio, digital, how do you look at that, and how, like, what are the buckets
Sure.
percentage wise?
Yeah, I mean, we look at all of them. It varies. Like obviously last year outdoor was not very little, right?
Right.
And it varies depending on your segment. Radio can still be very effective in some segments. TV is a little bit more challenging. We're starting to experiment with over-the-top TV kind of and streaming and those types of things. But we look at the whole mix, and we look at it again. We look at the line of business, we look at the customer, and ultimately it's about where do we reach them, what's the most effective way. And direct mail is still very effective.
Oh yeah,
hugely effective. So especially in the context of healthcare, right? So again, we look at all those channels and mediums, but I would say, obviously digital is big, search is big, and probably TV less so. But depending on, like, if you're in, say, in some of the non-urban areas, you get outside, radio and outdoor can become really important. So the location, the segments, the line of business, all those play a big part in thus choosing what are the right mix for that audience.
I asked about media mix a little bit because eMarketer had produced a report, I think it was January or February, and it really, really talked about, like, during the pandemic, a lot of brands pulled out their marketing and had to mix things up, and but a lot of it was pausing. Like, the current commercial is no longer relevant. We need to change the communication. We have to be relevant to the COVID paradigm, and now brands are coming back. And what the research is showing is billions and billions of dollars more pouring into digital. It's coming from out of home. It's coming from TV. It's coming from mediums where it's harder to move budget around or cancel or create new assets for, like TV. Really difficult to pull out of those commitments, especially if you have upfront commitments. Secondarily, if you got to change a commercial drastically, that could take months. You got the talent, the writing it, the shooting it, the editing, and the launching, getting it all out there. And while that's gotten easier because a lot of it is digital now, it's still a big problem. So the issue that's creating is that even within Facebook, I think like $3 billion more this year than last year or something like that. Like the trajectory is more money will be spent on Amazon, Facebook, and Google than ever anticipated, in the billions.
Yeah.
That's causing upward pressure on pricing for a lot of companies that are digital first.
Right.
Are you seeing that increase in costs, and is that actually?
I think we'll see it in the next couple of months when we get closer to the open enrollment. That's when a lot of we start seeing that. But yeah, it's kind of expected. Your thoughts around TV is absolutely right, because it still takes time to develop new campaigns and talent and writing and shooting and all that. And then there's a commitment to it, right? But I also want to say last year, despite the challenges, there was a lot of great spots that were created. And in some ways, it showed that you can create great spots without a lot of investment in terms of, production. And I think that was interesting, right? Because we're all in that, these great productions that you see, and yet it showed that at the end of the day, it's about the story, right? And how do you connect with the hearts and minds of people? And what is that story you're trying to tell? It's not just about, the production. So I thought there was a lot of good takeaways, what we can learn from last year's in terms of the advertising that we saw.
Yeah, sometimes it felt more authentic.
Exactly.
Less glitzy, less like, hey, let's make this like, oh, it's gonna be as good as Game of Thrones. Like, no, it's a 30-second spot, or it's just 60. Like, so sometimes it just comes across, and I felt better connection with people because it's just more real.
Exactly. More authentic, more real, more about the message than the noise around it, right? So yeah, I thought those, and then significant reduction in production costs. You know, you could do a spot. We did a spot last year in literally a few weeks, and it was very impactful, right? Whereas normally it would be months.
Yeah. I'm going to switch gears a little bit, and we talked about the journey a little bit, and one of the things that in previous discussion, you talked about some of the challenges are silos. People actually just acquisition only, or they're really just thinking about retention, and they're not thinking about it in the broader context of the journey that this person's going on. Where are they in the journey? Whose turn is it to talk to them? And then coordinating that across all the departments, breaking down those silos that actually were problematic. Where's Moda in that process, and in terms of being able to collaborate across different groups and really follow the journey? How challenging is that?
Sure. We've made a lot of strides in that. We're very collaborative across the different functions, but still a challenge. You know what I mean? You have what I call the phone customer service versus the digital customer service, which is all your apps and portals. And then, for example, in the context of our organization, we have healthcare people that are dealing with patients in terms of their case coordinations, in terms of wellness and so forth. So trying to put all this together, right, and be able to have that journey, again, also in the context of healthcare where it's episodic, it's really, really difficult, but you got to work through it. And that's what we're doing. And again, we're adopting ways to more collaborate with those functions. How do we bring systems and structures in ways that allows us to at least have visibility across from a customer that just went through someone and now they're speaking to someone else? How can we make sure? So I think, again, with advancements in technology, integration, a lot of those things will become a lot more easier. But having worked with so many other businesses in other industries in my prior work, I just find healthcare a lot more challenging because of the nature of it, basically.
Right. And are you building everything in-house, or are you using some vendors, to help manage, all the data? Because the hardest thing is actually, like each one of the groups maybe, having one view of the customer. Right. Are there certain technologies or certain companies that you rely on to help you navigate that, or are you building everything in-house?
Well, previously we were relying on building a lot in-house, and that's just becomes, you have to kind of find what are the ones that you truly are your IP, and which are the ones that you need to complement. And I think now we're going through that realization that it's not possible to build everything in-house. So you have to be very strategic of what is that core that you're building, and what are those spokes that you're kind of complementing it through the outside, and then how do you obviously connect all of them together. So we're going through that process right now.
Got it. I'm sure that's challenging.
Oh, very. I mean, well, you got to start with you have, especially in the context, again, of insurance, you have a lot of legacy systems because you have your claims data and all of these and on certain enterprise systems. And then now you're trying to build this 360 view of a customer through a new database sets. And how do you get all these things together with millions and billions of records? That's the challenge, obviously.
Yeah. Now, when you're communicating with customers, are you doing that through, apps, through emailing them? Like, what is the primary way of you communicating with your current customers?
Email and direct mail.
Email and direct mail. Yeah. Great channels. Yeah. still works.
And then phone.
And then you mentioned eventually phone. Yep. And eventually, does that include text? Like, is text?
It's beginning. You also have to make sure, again, from a HIPAA opt-in, and when can you do text? So again, there's kind of regulations around texting, and especially in the context of Medicare market and so forth. And so we're beginning to experiment a lot more with text.
Got it. And we talked a little bit on the acquisition side. Now we're talking about retention. Will you also be experimenting, loading up audiences that maybe are just harder to engage with, or it's just another way of re-engaging, but maybe using people-based marketing platforms, uploading customer segments, and then messaging people just finding them where they're hanging out. Like they might not be answering your emails or looking in your app and, maybe just throwing away your direct mail. So is there a way of leveraging first-party data, maybe in the future, where you're leveraging first-party data to communicate with people outside of the borders of your own properties and direct mail and email?
In terms of retention, again, at the end of the day, you want to make meaningful interactions, right? So if the person is not engaged because they're not going to a doctor, they don't think of health insurance is not their priority and top of mind. The question is, how are you creating value for them, right? So that becomes the biggest challenge is how do we create value? What is it that they'll be interested in having an engagement with us? The ones that are already, let's say they have a chronic conditions, they're already highly engaged, right? For them, it's how do we help them on their journey to get better, right? And then you have the whole spectrum of people that come in and go out. So ultimately, every engagement is about creating value for them. So I think for me, it's always trying to understand where's the intersection between us and them in terms of once we know how to create that value, I think then it becomes easier how to reach them, when to reach them, and what to say. But I think that value creation through interaction, I think, is the primary responsibility for us to kind of understand and appreciate what that is.
I wasn't sure if there might be a world where, leveraging, native or something that seems more endemic or advertorial, where you're actually, trying to reach out and find current customers, but getting that education information out there, leveraging the media pipes to do more retention. So that retention isn't just all about email and phones and direct mail, but that you're leveraging all the ad tech and martech pipes to find people where they're hanging out and get that communication out to them. Again, balancing the challenges of HIPAA at the same time, right? And maybe only working with people that are HIPAA compliant might be a new way of doing that.
As I said, reaching is fine, but with what message? What value are you creating, right?
Right.
And I think the expectations of people in terms of interactions with their health insurance are maybe a little bit different in terms of they don't want to be just, it's not like I'm a fashion company trying to inspire you with some, I got to really try to provide value to you as it pertains to your health. And if it's not to your health, the health of your kids, the community.
Right.
So to me, it's always about what does that value look like for them?
Right. Something that's very popular in the news and obviously been getting a lot of airplay, is around diversity and inclusion, within companies. Any initiatives internally, as a company to address, diversity and inclusion?
Well, I mean, it's a big part of our organization as well, and it has been. I mean, I remember when I first joined the company, I was part of our diversity committee. So for us, it's been within the organization for a number of years, and every year we're trying to really build on that, both from an employee perspective, but also from a customer's perspective. And then there are also rules and regulations that are coming that you have to adopt in terms of when you're searching a doctor and knowing information about them in terms of maybe their race and gender and things like that, so that people can make choices based on those things as well. So, yeah, it's a big part of the organization, and for us, it's an important part.
Great. Now, time check, this will make sure, so at 3:20. I don't see any questions popping up. Hopefully I have the right Q&A open. Oh, there's a chat. It's here. 5 minutes left. Just for fun, let's talk a little bit about how did you keep your sanity during COVID? What were the delightful things that you did just to kind of keep yourself distracted or to have fun while you were at home for month over month?
Well, it was a challenge, I can assure you that. It really was a challenge. For me, my best avenue was just every day I would try to walk for an hour at least. Just exercise was my only way of really keeping my sanity. But I do think connecting with my team helped a lot. I would just call individuals just to see how they're doing and just chat. And so being able to maintain those connections, those relationships with the team was very helpful for me. But yeah, I mean, exercise and just walking, even though there was many days that, you know, especially in Portland, Oregon, I didn't want to go out and it was cold and raining, but I kind of had to do it. Otherwise I'd go insane. So.
Well, the nice thing about that is you're not looking at a screen. I
Absolutely.
was so tired looking at screens and looking at watching content on TV. It's all
Right.
screens. Like, oh, there's another screen. Oh, Dad, take a look at this thing I did on a screen.
Right.
Like, can we just stop looking? Even when I'm on my
Exactly.
Nordic track and writing and following
Yep.
someone, what am I doing? I'm staring at a screen. So I
Yep.
finally moved my bike, and so I could just stare out the window. You know, so just getting away from the electronics.
Absolutely. Yeah, I mean, we were also going through a year of election too, so there was a lot going on.
Yeah, that's interesting. Any favorite movies or TV shows?
You know, I not one that comes to mind. I cut the cord just before actually COVID. So I was going through this transition period already, and then I kind of got onto all these series and so forth. And it was good sort of during the time of COVID to be able to access so much content in terms of movies and series. But there was a lot of good ones, and there was a lot of bad ones in there too.
Sometimes the bad ones are like Sharknado. It gets low ratings, but my 14-year-old just loves Sharknado. So sometimes the worse it is, the better it is.
It
Kind of
is.
kitschy and fun.
Yeah.
Hi, Andrea. How are you doing?
Hi there. Good. How are you guys? Great discussion. This is
Hi,
wonderful.
Andrea.
Sorry I missed you earlier.